हेलो फ्रेंड्स, एनोरेक्टल प्रॉब्लम्स वेरी कॉमन। एनएस के रिलेटेड जो भी प्रॉब्लम्स है बहुत कॉमन है, बट देर आर वेरी मच मिसकंसेप्शंस ऑफ द पीपल। फोर टाइप्स ऑफ रूटीन कॉमन एनोरेक्टल प्रॉब्लम्स आर देयर। एक जो है फिशर, सेकेंड है पाइल्स जिसको हम लोग हेमोरॉइड्स बोलते हैं, थर्ड इज पेरियनल एब्सिस एंड फोर्थ इज अ फिशुला फॉर्मेशन और फिशुला इन एनो। ये प्रॉब्लम्स क्यों होते हैं? सबका स्टूल्स तो एक ही जगह से आता है, एवरीबडी passes द स्टूल्स फ्रॉम द सेम एरिया, बट दीज प्रॉब्लम्स कम विद दोज पेशेंट्स जिनका खाने पीने का हैबिट्स बराबर नहीं है, जिनका वाटर इनटेक अच्छा नहीं है, सीडेंटरी लाइफस्टाइल है, या जिनको कॉन्स्टिपेशन है। दिस कॉन्स्टिपेशन मे बी अ हैबिचुअल कॉन्स्टिपेशन, मे बी अ जेनेटिक कॉन्स्टिपेशन और मे बी अ ड्रग इंड्यूस कॉन्स्टिपेशन। ये प्रॉब्लम्स के मिसकंसेप्शन ऐसे है कि किसी को पता ही नहीं है उसको क्या प्रॉब्लम है। उसको फिशर है क्या, उसको पाइल्स है क्या, उसको फिशुला है, ये किसी को मालूम ही नहीं रहता है अनलेस यू गो टू अ डॉक्टर फॉर विच यू हैव टू टेक अ प्रॉपर ट्रीटमेंट। बट व्हाट आर द डूज एंड डोंट्स फॉर दिस? ये प्रॉब्लम्स होने नहीं चाहिए, अगर है तो उसको हम लोग कैसे कम कर सकते हैं? First, an important thing is adequate water intake. People says that plenty of water. This is not the thing. Adequate water intake for any adults, it requires 2.5 to 3 liters of water intake. So if you are non-diabetic वगैरह, then you can have water intake in any form: water, coconut water, juices, whatever it is. Second thing is your diet. Diet should contain the high fiber. High fiber diet means क्या? Hmm, green leafy vegetables, salads, fruits. This intake should be good in the diet. If your diet is not contain fibers, you can have artificial fibers comes into the market. You can have that fibers also. The third thing is your bowel habits. You have to have a good diet, healthy diet, avoid spicy, non-veg, and too much. That is a too much of thing. Too much of spicy, non-veg you have to avoid. What about the constipation? Apart from your fluids, apart from your diet, you have to develop your proper constipation. Treat your own constipation. You have to have regularized bowel movements. If there are any factors like female patients, they are sometimes on uh, drugs which are iron containing drugs or calcium containing drugs. Yeah, some vitamins they do give constipation. So you have to change these drugs or modify your diet or stop these drugs to avoid drug induced constipation. If at all it is a genetic constipation, you can't help it, but there are some treatment or remedies or drugs also which will regularize your bowel movements. If at all you are having minor problems, you follow these advice of guidelines of diet, fiber content in the diet, adequate water intake, and avoid constipation and straining, and avoid spicy, oily, non-veg foods. You can reduce your these problems. If at all you are having these problems and you undergone any surgery, this will help you to get early recovery. But important is to go to a proper doctor, find out what exactly the problem is yours. There are problems which requires only surgery. They cannot be cured with non-surgical treatment, but unless you diagnose, you cannot do it. The treatment part is very much important. Don't be shy of, go to a proper doctor, consult your doctor and get yourself treated. Keep watching our next series of videos which will cover up piles, fissures, perianal abscess and fissulas in future in detail. Thank you.